Hello, very good evening to all of you. Today we are going to discuss the case note of Mrs. AISHA AMARI. And this is a referral letter to home care nurse Sharon Witkins, who lives in, who has to go to Braybrook, where Mrs. AMARI lives. So this is a letter which is written to a home care nurse. And she is assigned to take care of Mrs. AISHA AMARI at her home in Braybrook. So that's that. The letter is now we need to give information regarding how she lives and what her medical condition is and what's the requirements, all these things. Let's see what things we have to include in this letter. So before that, we need to go to the letter as a whole. So this is a 75-year-old woman who has come to our clinic. That's Westboro Medical Clinic. And that she got admitted today. And she had complaints of ambulation. While she ambulates, her left foot turns out. She has weak ankle pain, which is chronic, and she has burning sensation. So these are the presenting complaints which are important to, we need to let the home care nurse know these present complaints. Now, the past medical history, mild memory loss, this is important because she is caring. She needs to give some instructions whether it should be in a simple way or not. So this is important. Vision blurry, retinal damage. So in way you are going to see it, whether we need to include or not. Now, hypertension and diabetes, type 2 diabetes. So this is important because she needs to know when she has to care her regarding her diet and all. It is important there. Cataract surgery, appendectomy, now important there. Family history now important. Now the diet is important, diabetic and low cholesterol. Family brings some meals, it's not important now. Well, she has to take care about the diet, and she has to remember whether her diet is diabetic and low cholesterol here. Now, regarding the medications, it is self-administered, and the son calls to remind paracetamol is required. So this is intervention now, paracetamol for pain, deep heat cream, Diabex, and this is the for the pain relief and inflammation relief there. Beta blockers and calcium channel blockers are ongoing medications there. Physical review, there is no problem regarding her height, weight, alertness, orientation, hearing, speech, skin intact, continental bowel, bladder, no problem with all these things. So it's all quite normal there. Now, assessment, now ambulance transfer independently. This is important now, whether she's able to walk independently or not. So she's okay. Now, recent falls, no important, no assisted devices. It's not important right now. We'll see to it later. Now, mobile phone with her all the time. So now this is important. Now, this is some more of communication which you can communicate with patient in case in case of an emergency. If you need to contact the patient, you can contact her in mobile phone. So her mobile phone is an alerting device there. Pull cord in bedroom and bathroom. So this is another alerting device now. So if in case of emergency, she can pull cord in bedroom or bathroom there. Now, this is another thing which is important, that this language is, she speaks only Arabic there. And
unknown caller.
Yes. Excuse me. Now, welcome back. There was a disturbance in between again. Now, this is a problem here. The language is Arabic, so the language limitation is there, and the interpreter is Ahmad, is the only information source. So this is something which is important there. And now the son is very involved in shopping errands and finance there. Now, your responsibilities are there here in the management plan here. It's checking food or ankle. Personal assistance require 4 hours a day, twice a week. So this is something important there. So dressing, shower, some household chores and laundry, this is the help she needs. And installation of some assistive device, and you need to supervise or organize the installation of assistive device. Right now she has no assistive device in her house apart from a mobile phone and a pull cord. So this is some more assistive devices she may need regarding her ambulation or something like that. So this is as a home care nurse, so you have to take care of this thing. Thank you. Now let's see to the letter here, model here. So this is Sharon Wickens address is given, dear Mrs. I'm writing to refer Mrs. Aisha Mary, to whom you will be attending at her home in Braybrook. So you are assigned to do something. So you will be attending at her home in Braybrook. So this is what we are not. It's very clear that you will be attending at her home in Braybrook. That's it. In the case note, it is very clear. So no confusions there. She's suffering from chronic ankle pain, weakness, and ambulatory difficulties with her left foot. Now I can say chronic ankle pain, ankle weakness. Now, so where the weakness is ankle weakness, chronic ankle pain, ankle weakness, and ambulatory difficulty with her left foot. So now it is clear. Upon her admission today, so today she got admitted and Mrs. AMARI was seen ambulating independently despite her left foot hurts while walking. So this is her complaint now. What is her ambulatory difficulty is that left foot turns out while walking. She also complained of burning sensation in the affected ankle. So that's another complaint. Therefore, deep heat cream Diabex was applied, and she was recommended to have paracetamol when recommended. This was the thing we started. So she is on deep heat cream, and we have recommended paracetamol for the pain. Now, Mrs. AMARI lives with her son, who is very involved in her shopping, rents, finance, and so involved in her language. Oh, no issues. We are going to say that again. Shopping, errands, and finance, no problem. She keeps her mobile phone with all the times and pulls phone. So this is what we are going to see the situations now. So who is helping her, Ahmad, and in which way he is helping, it is given. Now she has some sorts of assistive devices right now, some sorts. It's not assistive devices actually, but she has a mobile phone and she has pull cords in her bathroom. She needs more because she has problems with her mobilization. So now, however, her language proficiency is limited to Arabic and has mild memory loss. Now, this is something very, very important regarding interpretation. You need to include the interpretation. The son is the only interpreter here, so you need to include this in the writing. So regarding the condition, medical condition, it is diabetic hypertension, and she's on self-medication prompted by her son. So this is something another important thing. Now she is taking self-medication herself, but her son reminds her to take the medications. Now, the food intake, regarding to her food intake, it is diabetic, low cholesterol. Now, requirement, so you are requesting the home nurse to provide personal assistance for Mrs. AMARI 4 hours a day, twice a week. Kindly check her ankle regularly and assist her in her activities of daily living, including some household shop. In addition, please organize the installation of assistive devices, which so that's it. We have come to the end of this particular letter. It's not a perfect letter. We have to cut short of the words in order to fit into the perfect OET letter sample now. But anyway, it is we have selected the relevant information which is needed to the home care nurse, and we have organized it correctly, almost correctly. So thank you. See you again with another letter. Thank you.